Experts demand apology for COVID vaccine mandates to restore public health trust. Came up this morning. I only saw it recently. I only saw it come up this morning. It seems like there's still fallout from the former Victorian Chief of Officer's statements from the other week, admitting that the state had overcorrected during the lockdown mandates, etc. But where is this paper? Public Health Policy Journal. I don't know how reliable that is as a paper, but this idea of vaccine mandates and lack of transparency has led to a plummeting trust in public health. Yeah, that seems like a statement of the obvious. Well, to some people, other people are like, what do you mean? We talked about this the other week when we looked at an article that was talking about declining vaccination rates for existing safe vaccines for things like measles and whatnot. So we're not talking about COVID jabs. We're talking about the decades-long vaccination schedule and vaccines that have been used like forever, and how there was a increasing reluctance from people to go and get those jabs. And the article had obviously a number of potential causes for it, and out of those causes and contributing factors, all but one of the factors were consistent over time, or relatively consistent, which was like access to doctors, inability to get appointments, things like that. The one that had changed in the last 10 years, so in the last 5-6 years, was the impact of COVID, of the imposed vaccination program and everything else, and the outcomes that people got from it, the injuries that people got from the vaccines, etc., the lack of transparency in what was going on. And so it took a bunch of people who were not anti-vaxxers, I mean, they never changed their position, but who were either vaccine hesitant or ambivalent, and has driven them into an anti-vaccine stance or into a more hostile stance, and they, demand more trust. They demand more safety and transparency before accepting the schedule or not buying into it at all. And the people who were arguing that this was going to lead to a breakdown of public trust back when it was going on, yeah, they had their voices suppressed. They were dismissed as cooks, as crazy people. But yeah, I don't think though that the loss of trust in public health is going to be undone by an apology. Oh no, the damage is generational. It's the sort of thing that, yeah, the people involved with forcing it down people's throats, I don't think stop to consider the long-term consequences, really. I was talking to someone the other day about it. The idea that we had a lot of people who were in positions of leadership in their relative industries or relevant areas of work and life and things like that, but they were being called upon to make decisions or to provide guidance at a level far beyond what they were used to. And so people panicked, people didn't know how to cope with the sudden responsibility or lack thereof, and that quite often there was a lack of accountability and responsibility to be had in various sections. Divisive cardiologist. Okay, fair enough. I mean, not happy. I mean, he's obviously sounds like he's been a vocal critic of the mRNA vaccines. Not the only person. But I don't know that even if there's a public apology vaccine-injured patients, the public, and whistleblowing doctors, it's not going to fix things. I mean, it's a political problem at this point. Just look at US politics, really. Look at what happened going into and coming out of Trump's first term. Look at what's happened going into the start of his second term. There's been malfeasance that's been shown to have existed and been done on a political basis. Yet, even if one side apologised for what they did, it's not going to fix the problem. It's not going to change what people think. It's just going to reinforce the ideas that people already have. And, well, out of these suggestions, okay, I don't know that that's going to carry much. I mean, yes, maybe they should front up to what they did to suppress people who were not buying into things straight up. Okay, fair enough. But a global moratorium on mRNA vaccines, particularly COVID-19 ones, yeah, I'd see the medical papers that people were putting forward out of the New England Medical Journal, out of Lancet, out of BMJ, and out of a bunch of other medical journals around the place. The papers didn't didn't show the unequivocal science that people said they did, and that there were aspects of concern with how the papers were written, or who wrote the papers, who was funding the papers, that were it any other industry, were it, say, climate science, they would have been rejected as being industry plants. Yet, for some reason, that level of cognitive critical assessment just wasn't being applied. And there were other concerns about the nature of some of the studies and the conclusions reached that didn't seem to carry the statistical weighting that was claimed. And as a result, it was like, well, then the paper being waved around as being, this is the gospel truth, you now go and do what we tell you to, it became a political tool, and it wasn't allowed to stand on the science, or the science within it wasn't allowed to be assessed and discussed in a rational, reasonable manner. And so any potential good that the paper actually had the ability to do was very rapidly undone with how it was used as a weapon. And there were papers withdrawn during that period, published by the Lancet and then withdrawn. There were, it's the sort of time and space, it's very hard to reproduce studies. So you've got the reproducibility crisis affecting all science, affecting these papers as well. It was messy. It was messy. And so the cautious response, which was, okay, we're going to sit on hands and let information build, was seen as a denial, as a denier's position. And when you talk about, say, politicisation or extremism of ideas, this is one of those events where if you weren't all for it, you must be completely against it. And so the moderate position, or the position that was like, let us take the time to read these and understand these papers and have a look at how these jabs have been brought onto the market, what studies, what's their safety, what's their effectiveness, where are the test, where's the animal testing results, where are the human test results? Like, they've got to go through an accreditation process. Where are these results? Like, how many of the medical testing bodies and cohorts, what were their results? And so people got suspicious. And then that suspicion was then regarded as being a heretic. And you were then treated as such. And yeah, it's that whole phase for a couple of years there is going to be, it's a very interesting set of studies, I guess, observations, example of groupthink and appeals to authority. There is, yeah, if it wasn't for the fact everybody was in it, it might have been possible to have a bit more objective statements and observability. So, are we going to see accountability? Well, I don't know that this effort to restore legitimacy, I don't know that is going to be enough. Like I said, the damage is done. It's generational damage now. I can't see a path, even if they did do this. The trust has been broken to the extent that, it's not just, oh, we're sorry. That's not going to bring people back. It might bring some back. Yeah. I mean, they're citing the former Victorian Chief Health Officer's statements as support for their position. Fair enough. Saying that, the public health crisis, it's, problematic. Very problematic. There's other elements. So people accused of then spreading misinformation and pseudoscience about about COVID vaccines and stuff. Well, that's just the words used to describe somebody. I mean, potentially it is, but when it gets used as a blanket statement, it doesn't help anyone. Does not help anyone. So, I mean, trust. Trust in the CDC since 2020 to 2025 went from 3/4 to less than 2/3. That's quite a fall. That's quite a fall. BMJ Good Health, the British Medical Journal, I think, that mandatory COVID vaccine policies did more harm than good, damaging trust, vaccine confidence, yes, political polarisation, yep. All right, human rights, inequities, and social well-being. Okay, I haven't talked about those sort of things, but yeah, they had an impact on that. I mean, various elements of society suffered more than others. They said that there was a period of wealth transfer, one of the greatest periods of wealth transfer ever. The rich got much richer, and everybody else suffered, pretty much. Even more critically, trust in doctors and hospitals in the US from nearly 3/4 to less than half in 4 years. People don't trust doctors anymore. And there's some people who are unlikely to ever trust them again. So, whilst, no, I don't agree with this. If you've ever been put in a position of leadership or decision making, particularly in a field where you're not going to get, never going to get 100% information that you need to make the decision, you're going to know that this is an excuse. That if you're going to use this to justify why you did what you did, you shouldn't be making those decisions. You should step aside and let someone else who can do it, or who's willing to accept responsibility, to come through and do it. So, decisions were made under uncertainty, guided by the best. Well, I don't think it was necessarily. It's an excuse. Cannot extend it indefinitely. Once evidence emerged that challenged initial assumptions, the ethical obligation is to reassess policy. No, thumb screws got tightened. And yeah, failure to back up. Failure to acknowledge details to do with the vaccines, perhaps the most egregious failure. And yeah, I agree with that. It's just it's a problem. Why is it coming up anyway? Yes, rather than engaging, people largely went down a reputational attack and professional sanctioning. Silence over silence, silence over science. It's yeah. I think it didn't just damage people's trust in medicine. It damaged people's trust in science. Really, it's it's interesting. I think it's a fair article. Quite obviously, there's going to be a lot of people. Yeah. Okay. So in October, the final report into Australia's COVID response concluded that heavy-handed rules and vaccine mandates had eroded public trust. What a surprise. We have a responsibility, particularly as a government, to examine our response to the pandemic, learn what... Okay, no, you didn't do anything well. As of July, so this is concerning. Well, not concerning. It just sort of highlights what people have been doing and saying and where it's all come from. That as of July 2025, 2.3 million, or about 8% of the population, have taken a COVID vaccine in the prior 12 months. That's less than the number of people in poverty that we just covered. And that the government now only recommends the vaccine for those aged 65 and over and people with severe immunocompromise. So they're now back to the cohorts they should have been sticking with. Anyway, for those individuals recommended to receive the vaccine, the risks of severe disease from COVID-19 are the highest, and the benefits of vaccine outweigh the risks for the defined population. In other words, if you get COVID, it's going to be worse than getting the side effects from the jabs. This word, okay, coming from the TGA, if you've read a lot of government documents, policy documents, things to do with liability, where you can see people trying to dodge out of taking responsibility for something, to see a word like largely appear. So it's telling that the statement is not COVID vaccines are safe. It's COVID vaccines are largely safe. That's a very interesting qualifier to put on a thing. Now, if I had the time and wherewithal to look deeper at it, I'd look at what largely is meant to represent in a document like that. I mean, sure, there's the guideline somewhere as to when you should use that word. It's like the use of the word shall, or it's a directive, as in so-and-so shall do X, Y, Z. It's a directive to the individual reading or to the individual so named to go and do what they've got to do. It's a it comes down to, I guess, a very legal definition or very legal use of the word. I mean, there's shall, there's will, there's a couple of other, I can't remember the other words that were often used. But when you saw words like that, you knew that what it was talking about was basically an order to go and do that, or else you'd be in breach of whatever that document or book or policy or whatever it was. And it's, legalese to an extent, but it's important to understand, I guess, how those words get used. Largely. That's interesting.